The evolution of pain management is fascinating, really, especially when you see all the emerging technology that exists to help people avoid living in agony. In this segment, sponsored by OrthoNeuro, we have Dr. Dustin Reynolds here to share all the tools at his disposal. Great to have you on with us.
Well, thank you for having me here today.
All right, before we kind of jump into this topic, I want to talk about you and a little bit in your area of expertise, kind of what you do at OrthoNeuro.
Yeah, so I'm an interventional pain management specialist. My primary specialty is anesthesiology. Myself and my colleague, our other pain management physician, is Dr. Daniel Papp, and we focus on conservative care, the minimally invasive approach to care first. Physical therapy, medication management, injection therapy, things before and after surgery, but also new advices, techniques that we can employ to treat that chronic pain.
Okay, so we're talking about neuromodulation, it's called. It's not a commonly known term, perhaps, to people watching. So first, explain to us what that means.
Yeah, so neuromodulation is a way to take an abnormal or aberrant nerve response, replace it with a positive stimulus, and kind of cancel out that painful stimuli. So think noise-canceling headphones for your pain. It's a way to take that stimulus, like bumping your knee. You feel that sharp, sudden pain, and then you rub it away. That's replacing that stimulus. The same thing that these devices can do.
Okay, yeah, so let's talk about these devices. Then you have a couple of examples.
Yeah.
So what are we looking at? What do they do?
Yeah, so our main neuromodulation devices are spinal cord stimulation therapy, dorsal root ganglion stimulation therapy, and peripheral nerve stimulation therapy. We work with a lot of different companies. I personally enjoy working with the company Abbott, who we have here in town, with their nutritional side of things. But they have the smallest battery on the market, and this electrode that you'll see here, it's kind of like fishing line.
I was going to say, that is very, very thin. What exactly is that?
Yeah.
I mean, you can see it.
Yeah, so for injuries that we use in the spinal cord, say before or after the treatment of spine pain, surgical pain, we can implant these electrodes for 7 days. It's a trial basis, kind of a try if you buy, or try before you buy type technique, to stimulate an area of the spinal cord that cancels that pain response going to the brain. It interferes with that signaling highway. So if we get positive results during that 7-day trial, then we'll talk more about implantation.
Okay, then it's a permanent kind of thing versus just the trial. Okay.
Yeah, so minimally invasive, the procedure itself only takes about 10-15 minutes for the trial, and then we bring you back in a week later, talk about your results. We're hoping for at least 50% improvement or greater. I like to see 70%. I want to see a higher marker for success. I want you to actually feel that lifestyle change from this device.
And when we talk about people who are dealing with kind of that type of pain and that issue, do you see it happening for common ailments? Like, what causes them to have so much nerve pain? Is it often an injury or age, or
a little bit of everything, honestly, multifactorial. So we can treat focal or localized pain. You can think foot and ankle, hip, spine, neck, shoulder. You know, we can target specific nerves with peripheral nerve stimulating devices in the lower extremities or upper extremities as well. Dorsal root ganglion stimulation therapy kind of focuses in on that. Spinal cord stimulation therapy works on a wider area, a more widespread dispersion of your pain, if you will.
Okay.
So, yeah, they're great in all areas of the body. It just depends on what type of pain you're having. That can be, you know, surgical pain, that can be, you know, arthritic pain, that can be peripheral diabetic neuropathy, which a lot of our patients have.
Yeah, and you talk about, because I feel like nerve pain is almost this unbelievable pain that a lot of people deal with when they have a nerve issue. So is it also, you know, nerve, muscle, joint? Does it help with all of that, or is it just a nerve-focused kind of treatment?
So that's a hard question to answer there. Like I said, it's multifactorial. Yes, it can help all of those different ailments, but it does focus on the nerve response to your pain.
Got it.
So interfering with that pain signaling, almost tricking the brain into sensing that you have no pain, or decreasing the chemical mediators that cause your pain.
Got it. And people living with this pain, of course, I'm sure are absolutely thrilled that there is an option for them, that there is something that can take away a bit of that intensity for your patients.
Absolutely. Our whole goal through OrthoNeuro is get you back on your feet, get your quality of life back, avoid surgery when possible. My partner and myself, we do not practice opioid therapy. We want to avoid that and all the negative side effects that come along with it. Don't get me wrong, there are times when opioid therapy should be utilized. Cancer pain, end-of-life care, acute post-operative surgical pain, all great reasons for that, but other modalities should be used.
Yeah, definitely. Well, it's great to know there are technologies, there are therapies out there. So, doctor, thank you.
Absolutely.